Welcome to a special edition of Foad and Friends, where we sort out fact from fiction. We're in Miami Beach at the aesthetic meeting, and we're at the booth of Aveli, which is one of the latest technologies for dealing with cellulite. 80 to 90% of women have cellulite, and there have been many options, some of which that work, some that don't work. Uh, there are several technologies which include ultrasound, various injections, even lasers, and in the right hand and on the right patient, they're all effective. We're concentrating on a new technology today which doesn't require any financial outlay, no fancy machines. It is an outpatient procedure under local anesthesia where the bands that cause cellulite are singled out and then disrupted. I'm going to turn it over to Brian Bassiri-Tehrani, our fellow, my co-friend, and he will demonstrate the technology.
Thank you, Dr. Nahai. And before I get started, I'm just going to show how this works. And this is basically the wands that we use. And it has a few special features. As you can see here, it opens up like that. And the point of this is so that it goes around the fibrous septa that attaches from the soft tissue and the skin and creates that dimpling, also known as that cellulite. And so we use this in special ways, and I'm going to demonstrate it right now to break up that fibrous septa. So I'm going to hold this and give that to you, and we'll do an example here. And so let's say this is the skin. This circle represents that zone of that fibrous septa. We're going to go underneath the skin through a tiny port site, and we're going to use this light as an indication. This light is not energy, and we're going to engage the blade and come back and see where it's tugging. And you can see the light is in that zone of adhesion that we marked. It's right where that fibrous septa is. And so the blade is engaged but not fully engaged. And when I press this button and use my non-dominant hand to give counter tension, you just saw that pop a little bit. Now I'm going to put the blade down and verify to make sure that there's no other bands there. Partially engage the blade. I don't get any snag anymore, and I know I did it right. And I double check, go a little bit outside of where I went, partially engage the blade, not getting much dimpling, so I know I'm safe. Disengage the blade to make sure I'm not causing unnecessary trauma, and do it again. Now I'm in a different zone of that circle, partially engage the blade, come back, minimal snagging, but it is snagging nonetheless, so that's enough to engage it fully. Press the button to fully engage, non-dominant hand counter tension, and you just saw that pop. Disengage the blade, and then lastly, verify. You do that a couple of times in each zone, and make sure that there's no other areas that are snagging, and I'm doing that right now, and I don't see anything. And again, just partially engaging to see if it's getting stuck, and if not, disengage the blade so you're not causing unnecessary trauma to the tissues. So I don't see, I don't feel, and that's pretty much it.
Thank you, Brian, for the demonstration. As I mentioned, this is an office procedure under local anesthesia. The advantage of this instrument, this device, is that you can confirm that you have released the bands that cause cellulite. So that's all for this special session of Fuad and Friends. We're still in Miami, and we'll see you again soon.